We are live, sir.
Okay.
Good afternoon, everyone. I'm Dr. Kirti. Before we start today's session, let me tell you all that today we all are celebrating World Health Day. And the theme of this year is our planet, our Earth. So let's take pledge to take care of our Mother Earth as we are trying to take care of ourselves. Now, coming to the topic of today's session, let me tell you first a little about the liver. Liver is the largest organ inside our body. It helps to digest food, store energy, and remove toxins. And fatty liver disease is a common condition caused by the storage of extra fat in the liver. Most people have no symptoms and it doesn't cause serious problems, but in some cases, though, it can lead to liver damage. The good news is you can prevent or even reverse fatty liver disease with lifestyle changes. So to know more, we have Dr. Makkar with us. Welcome, sir.
Thank you, Dr. Kirti. Good afternoon, everyone.
Sir, the first question to you of the day is, what exactly is fatty liver disease?
In simple terms, it is basically, fatty liver disease means that there is accumulation of fat in the liver or in the liver cells to an extent that it is now becoming harmful for health. So just sheer presence of fat, which is leading to ongoing damage or increasing the risk for health, is the condition called fatty liver.
Right, sir. And how common is fatty liver disease these days?
So important thing here is that it is so common now that we can expect to see it in practically every 2 out of 3 or 2 out of 4 people that we come across. If you look at people who are overweight or obese, almost 70 to 80% people will have some degree of fatty liver. If you look at people with diabetes, again, almost 60 to 70% people have fatty liver. If you look at people with heart disease, if you look at people with high blood pressure, a lot of them will be having fatty liver. So it is very, very common. And important thing is, for whatever reason person goes for an ultrasound test, you will see whenever you are seeing an ultrasound report for the abdomen scan, you will frequently come across fatty liver as a component of the ultrasound report. But it is not perceived as an important issue by most of the people, despite ultrasound showing that there is fatty liver. So once you ask the patient or person who is visiting us that do you have ultrasound, you need to get an ultrasound to see fatty liver. So they will commonly tell, डॉक्टर साहब वो तो मेरा 4-5 साल से fatty liver ultrasound में आता है, because it is not causing any immediate problem or it is not causing symptoms. It is considered as a very benign or kind of harmful condition by most of the people, which it is not.
So you mean to say there are no symptoms for fatty liver disease and it's usually an incidental finding?
Yes. So most of the time it is not symptomatic. There is hardly any symptom that fatty liver causes, unless there is a gross enlargement of liver and somebody feels little heaviness on the right side of stomach. Normally there are no symptoms related to the fatty liver, and people try to actually most of the time people will say that I have indigestion because of fatty liver.
Yes.
So commonly they will relate their indigestion or their acidity or their gastritis or reflux to the fatty liver, which is, it is not. It is, those symptoms are different and it is not caused by fatty liver.
So we would like to know from you who all are at risk for fatty liver disease in general.
So some of the things I mentioned, but before we go on with who are at risk of fatty liver, first thing we should define, differentiate is that you will see fatty liver commonly in people who take excess alcohol regularly. So excess alcohol intake is also associated with fatty liver, and it is caused by the alcoholic liver disease. It is a stage in the alcoholic liver disease. So once somebody is taking excess alcohol on regular basis, then it causes damage to the liver. And the first clinical the marker that we pick up on ultrasound is the development of fatty changes in the liver. So it is the alcohol mediated damage caused to liver which shows up as fatty liver. Now the other component is the people who do not have any alcohol intake or who are taking very moderate alcohol intake like 2 or 3 drinks in a week or 2 small drinks on alternate days or maybe one drink every day for a week. Those are not the people where it is alcohol mediated damage. Then the fatty liver is because of something else, and most of the time it is related to the metabolic disturbances in the body. Now one of the common things that changes in these people where there is no alcohol toxicity on liver directly, there is either increase in weight or despite being slightly overweight, they have excess accumulation of fat in the wrong places in body, or they are physically inactive, so they develop insulin resistance. They may be having diabetes, they may be having high blood pressure, they may be having heart disease. All these things are, associated. They are part of the same spectrum of disease. So this is called as non-alcoholic fatty liver disease, NAFLD, where alcohol has been excluded as a cause of fatty liver. Now, why this fatty liver is coming? Because one, possibly there is a genetic predisposition. Second, the lifestyle is bad. People are consuming excess calories, people are overweight, and people are not able to store the amount of fat they have in body in a healthy state. So once there is excess fat accumulation in the body, there is a threshold of the body up to which point there will be no harm. And this threshold is different for different people, right? So this is the, you can say, adiposity threshold that different people have different levels. So once there is this threshold is exceeded, there is storage of excess fat within the fat cells. Now these cells are not, designed to store more fat than a particular level. Once there is excess fat storage, then they become tightly compressed. So they become, there is tight compression of fat, which is compressing the intracellular structures also. And this leads to inflammation within the cells and surrounding the cells. And in this state, they start, instead of storing fat, they start spilling out free fatty acids. And these free fatty acids start going to different organs where normally there is no fat storage. So this is called ectopic or abnormal, fat accumulation in different organs of the body. And liver is one of the organs which is prone to, accumulate excess fat in the abnormal side. So whenever there is excess accumulation of fat in liver, it is not a normal phenomena, it is abnormal phenomena. On one side, it can be alcohol mediated damage. If alcohol is not the cause, mostly it is metabolic derangement associated damage or accumulation which is happening in liver. So this is what is called now non-alcoholic fatty liver disease or metabolic associated, metabolism derangement associated fatty liver disease. Now, commonly you will see in overweight and obese people. Commonly you will see in diabetes persons, people with high blood pressure, people with heart disease, and these are the common associations that you will see with. And PCOD is again one common association in women where you will see fatty liver disease.
Do we see fatty liver in kids also?
If they are becoming overweight, they are physically inactive. Now we are seeing a lot of obesity happening in children. We are seeing type 2 diabetes, which used to occur at more than 45, 50 years of age. Now we are seeing at 18 years or 20 years of age. So the whole story is changing. So yes, we do see it is not that common as it is in adults, but children who are overweight or obese, it is a common finding now.
So how is fatty liver disease diagnosed? See, once we have picked it up by incidental finding, then what further?
So common ways, common things that give a clue to the presence of fatty liver disease is that you just run a routine blood check or a regular health check for a person, and you will find that the liver enzymes are abnormally increased. The commonly known enzymes are SGOT or SGPT or ALT, AST. These are the common enzymes which are increased, and they are not significantly increased, they are marginally increased. And this may be a clue to presence of fatty liver. So an ultrasound will show presence or absence of fatty liver in these individuals. Second thing is ultrasound, whenever it is done, for other reasons, it leads to incidental finding of fatty liver, and you can pick up fatty liver there. So these are the two common things that lead to diagnosis of fatty liver. Other things are that whenever you are working up a patient for obesity, for high blood pressure, for heart disease, you get an ultrasound and liver function test, you will find a fatty liver in large number of these patients. So this is how usually the diagnosis happens. It is not common uh, to for a person to come to a medical facility or a clinic and complain something related to fatty liver. So usually it is an incidental diagnosis.
We also talk about Fibroscan. Can you please put light on it?
So Fibroscan is again, important investigation to see the amount of fibrosis that is happening in the liver. So once there is fatty liver disease and it is left untreated, and the underlying causes like obesity or diabetes or insulin resistance, they are also not well controlled. So there is an ongoing accumulation of fat in the liver, and ultimately it leads to further damage within the liver, leading to development of fibrosis. Now, fibrosis cannot be picked up on ultrasound. So fibrosis can be picked up on a tool or a test called Fibroscan. And Fibroscan again can tell you a grade that it is initial stage of fibrosis, or it is advanced stage, or it is very advanced, it is reversible or not. And then there are certain scores to calculate the degree of fibrosis seen on Fibroscan. So Fibroscan is an advanced tool, but people with mild fatty liver disease, you don't need to put everybody for Fibroscan. Yes, it is an important tool to define presence of fibrosis, and if somebody can afford, yes, with moderate to grade 2 or grade 3 fatty liver disease, people should go for Fibroscan. But grade 1 fatty liver disease and not much issue, you can still do with the ultrasound. So Fibroscan is basically telling you that damage has progressed further or no. That is what Fibroscan is going to do.
So, sir, you mean to say that fatty liver disease is an early warning sign? And
Yes. So fatty liver disease is the initial stage of, which can progress to from grade 1 to grade 3, development of fibrosis, advanced fibrosis, and cirrhosis. Cirrhosis is the which becomes a chronic liver disease. So till these stages of early or moderate fibrosis, things may be reversible. But once there is advanced fibrosis or cirrhosis has set in, then this disease process becomes irreversible. We cannot reverse this. So it is very important to identify this disease early and intervene early, so that we don't let it go to chronic liver disease, which can be very crippling complication, and ultimately it leads to a terminal state.
so how can this fatty liver disease be treated?
So most important thing is to manage the lifestyle. Most important, currently we don't have many approved medications for treatment of fatty liver disease. So first thing is, uh, the most important component of management is to identify fatty liver disease as an important disease process. Not to neglect this, that this is just a benign, my fatty liver is there for 5 years and I don't do anything about it, because it doesn't trouble me. Because The complications will take many years to develop, but still they will develop. So first thing is to identify fatty liver disease, particularly non-alcoholic fatty liver disease, as an important disease which needs to be managed. And currently we do not have many medications which are approved for treatment of fatty liver disease or early fatty liver disease. So most important thing is component of treatment is the lifestyle interventions. A regular physical activity, regular exercise of moderate intensity has been shown to reverse or decongest liver from the fat. So, and also of course you have to focus on diet also. So reducing excess calories, reducing excess fat intake, and managing regular physical activity. These are helpful in controlling as well as reversing the early stages of fatty liver disease. And they are very important component even in advanced stages when we need to use some medication.
So you were talking about diet in the management. So does diet really play a good role in the management of
Absolutely. See,
fatty liver?
problem is now earlier we used to think maybe 30 years back we were a society which was a starved society. We had a lot of poor people and we had a lot of poverty, and it was common to feel good if you were having all three or two square meals and you were having a plump appearance or a slight belly. So it was thought that this person is getting enough food, this person is not starved person. The problem is that this was possibly not understood so well at that time, that we are all developing and we all developed insulin resistance, which is kind of survival mode to go through the periods of starvation. So as a result, when we were coming out of those starved or poverty ridden times, when we started getting adequate food, we started storing more fat and started developing more and more insulin resistance. And this led to excess accumulation of fat in the ectopic sites once the sufficient fat was already there in the subcutaneous tissue or under the skin, where the fat stores are largely. Now, other thing that happened was that over last 30 years, there has been a phenomenal increase in the mechanization. So availability of transportation has improved, availability of mechanized transportation has improved. Everything has become, technology driven. Even your TV has remote, even your fans have got remote, your electricity has got remote, your curtains have got remote. So people are hardly moving. So there is phenomenal decrease in the physical activity because of the mechanization or technology revolution. So the amount of calories that were required by any average individuals have come down. The requirement for calories came down and the supply or abundance persisted. And with improvement in the incomes, first thing people started doing was eating well. Eating well means eating overeating, not focusing on health, but just, focusing on eating and what they can eat with that money. And this led to the imbalance that there is on one side you have an ongoing decline in the requirement for calories because of mechanization, technology, and so on. On the other side, you are getting more money and food become abundant. We didn't have any famines. We had green revolution. The grain supply was consistent through the year. People were not starving most of the time. So there was abundance of food. There was decline in the activity, there was decreased requirement for food, there was increased consumption of food. So there is an imbalance leading to increasing levels of body weight. And if you see in last 30 years, there has been a significant increase in body weight. I clearly remember there was a study published way back, I think 1992 or 1998, I don't remember clearly, from Mumbai, where they had shown that about 2 to 8% of the population had overweight or obesity. Currently, in cities like Delhi, more than 50% of people are overweight or obese. If we include the rural population in India, every 1 in 5 people is overweight or obese. 20% of the adult population is overweight or obese across India now, including rural population. Initially, it was only the urban population which was getting obese. Now, even rural population is getting obese. So this clearly shows that imbalance is taking its toll, and non-alcoholic fatty liver disease or fatty liver disease is again one of the components here. So we have to, switch back to a balance between increased activity and decrease in calorie consumption, so that we can mobilize that excess fat which is there in the liver, and we are able to kind of reverse the traffic of fat from going into liver to rather getting out of liver. And that will happen only if you are having less calories than you require on daily basis. So once you do that, the fat mobilization, basically fat is an energy store. So whenever you have surplus consumption of calories or surplus availability of calories, the calories get stored as either glucose, which is the glycogen, which is the form of glucose stored in muscle. And after that, that is a very small storage. And large amount of storage happens as fat in fatty tissue. Now, when there is accumulation under the skin, it is not causing much problem. But once it exceeds that threshold, it starts getting accumulated in the abnormal size. Now, once you start cutting down the calories and increasing physical activity, and there is a net caloric deficit, that means your requirement is more than your total intake of calories, then you start mobilizing those extra calories from fat stores. And this mobilization to begin with happens from the ectopic fat sites or the abnormal fat sites. And that's where liver also gets improved. So this is largely, how the story goes inside the body. In very, very lay terms, I don't know whether I have been able to explain it or confuse it, but I have tried to explain it.
Sir, moral of the story is motapa.
Yes, but the unfortunate part is that in Indian setting, we get the bad effects of fat storage at much lower levels of body weight. So if we are getting, say, there is an index called body mass index, which is calculated based on height and weight. So the obesity definition for Western population is a body mass index of more than 30 kilograms per meter square. The same obesity definition for India is body mass index of more than 25. And if we translate in terms of kilos, this will be something like maybe 20 kilos of difference. The problem is that we Asians and particularly Indians get bad effects of fat at much lower level as compared to the Western population. And if we compare the two individuals with same body size and same body mass, one Indian and one white person, then we have almost 35 to 50% more fat as compared to this individual with same height and weight from the white population. So we have, constitutionally we have less muscle mass and more fat mass. And once you start exercising, you build up your muscle mass and you cut down your fat mass. And that helps your metabolism very significantly. So lifestyle interventions are, that is why, very, very important. And maybe we don't have that visible obesity or motapa, but even with the small increases in weight above the normal level, that is normal for Indian population, we start getting all these problems.
Perfect, sir. So there's a question from the audience. Can I have it?
Yes, why not?
So what is the alarming sign in fatty liver?
There is no alarming sign. That's a
alarming stage.
Alarming stage is that, as I mentioned, once you have grade 3 fatty liver and then you start seeing, fibrotic changes. Fibrotic changes on ultrasound do not appear early. They will appear only once they start disturbing the liver architecture. That means liver starts appearing irregular. And that is the stage when we call cirrhosis also. So that is the advanced stage that you will start seeing anything. So usually you will not have anything till you are seeing fatty liver. And I think we do not need to wait for the alarming stage, because once we reach the alarming stage, there is no, reversal happening. There is no return from that. It is a point of no return. And you are moving into a dark tunnel where the end is not so good. So it's better not to wait for the alarming stage. I think the most important thing is to get alarmed with presence of fat in liver. And if you get alarmed there, then you will be in good situation and you will be able to, improve it and save your liver.
So can fatty liver disease be reversed? And if yes, till what stage?
Fatty liver disease can certainly be reversed, and it can be reversed even at the early stages of fibrosis also. So grade 1, grade 2, grade 3 fatty liver, early fibrosis, all stages can get into reversal provided you act on it and act on it aggressively. There is no reason why you cannot reverse it.
And so what if fatty liver disease is left untreated?
So untreated, as I told you, one gets into the fibrosis stage, the liver starts getting damaged, the cells get, damaged by getting entrapped within the fibrous tissue, and the function starts going on declining. And ultimately, you reach a stage of cirrhosis or chronic liver disease where you end up with liver failure. Second thing is, once you are moving towards advanced, fibrosis, there is increased risk for developing hepatocellular carcinoma or liver cancer. And it can be as high as 6% in people who have, started with fatty liver disease. So there is increased risk of developing liver cancer also in people who leave it untreated. So it is very important to identify it early and treat it early. You don't need to leave it untreated.
So there's another question from the audience. Whether fatty liver reverses on its own or with weight reduction?
So, I think both things go hand in hand. Uh, Weight reduction, once you initiate the changes in diet and lifestyle, uh, it is very difficult to monitor that. We are not monitoring the movement of fat or decongestion of liver when you are going for lifestyle changes or dietary modifications. But even once you are following a good healthy diet and maintaining regular exercise, even in absence of significant weight reduction, there can be reversal of fatty liver disease if it is the early stages.
Sir, how would you like to conclude today's session?
So I think concluding message is that first thing is that alcoholic or non-alcoholic fatty liver disease is common. So don't think that if somebody is taking alcohol, then only one will get fatty liver. Fatty liver is more common now and very common in people who do not take alcohol also. Second thing, if you have slightest of overweight or obesity, please always keep a track of your liver fat and get an ultrasound done. If you have fatty liver, identify this as an important serious problem and start working on it. Consult your physician, treat it as early as possible. Don't ignore this as a benign problem. So early identification and early intervention is very important to keep your liver in good shape, because you need your liver functioning normally right till the end of your life. If liver gets into dysfunction or kidney gets into dysfunction, you cannot have a good health and you cannot have a good quality of life. So just do not ignore and try to look at the warning sign. You have developed diabetes, high blood pressure, heart disease, you are having overweight, you are physically inactive, you have bad eating habits. Always try to see that you are not having fatty liver also.
So that brings to the end of the session. Thank you everyone for joining.
Thank you, Dr. Kirti, and Thank you, everyone in the audience. And we hope that you are benefiting from these discussions. And we will be with you next Thursday again, 3 p.m. with something new for you. Thank you.
Thank you.
And stay healthy. Today is World Health Day. And I wish good health to everyone who are connected with us.